Hey y'all, my name is Aaron McCarty. I'm a nurse practitioner student with Auburn University, and I just wanted to come to y'all today and talk about the roles and responsibilities of an FNP and what an FNP does for healthcare. So you may hear FNP when you're out seeking healthcare, and that's called a family nurse practitioner, or FNP for short. So an FNP is a healthcare professional that provides a broad range of medical services to a diverse population. So anywhere from birth all the way to death. And so we practice within a wide range of population groups. So to start out with, a family nurse practitioner will go through nursing school and obtain their BSN degree. This is a 4-year program. Once they graduate, they'll sit for their national certification exam. Once they pass that, they can start practicing as a licensed nurse. Next, they'll move on to their MSN degree. So this is an additional 2 years. Once they graduate from there, they'll go on and do a national certification exam for their master's, and then they're allowed to practice as a provider. So when you're talking about a family nurse practitioner, they are allowed to bill for their services much like a provider or a physician would, but there's different tiers that they can bill at for their services. So there's 3 different kinds. There's incident billing, direct billing, and shared service billing. So in incident billing, the nurse practitioner, such as myself, would go in and provide most of the care that you may otherwise need, and then the physician would bill under their name. So in direct billing services, the provider, or myself, the nurse practitioner, would provide the care and also bill under my name. And then lastly, for the shared services billing, the physician and myself would provide the care, but usually the billing is directed underneath the physician's billing services. Now, when we talk about a family nurse practitioner, do you think that someone has to be in charge over them? Do you think we can practice independently of anybody else? What do you think, Brandon?
It sounds like a FNP is a subsidiary of a doctor that shares responsibilities between a doctor and a nurse, and that can provide more total care.
So that's really spot on. So a nurse practitioner has to have a collaborating physician within their practice as well. So myself, I cannot practice independently of another nurse practitioner or physician. So when I go into practice, I would have to have a collaborating physician that oversees me or kind of directs my care, someone that I can call on to say, hey, what do you think about this patient? Do I need to order more labs? What do you think their disease process might be or their diagnosis might be? So collaborating physician is going to be more of a supervisor that oversees me. So this collaborating physician has to be readily available. They have to be within my practice 10% of the time and at least visit this practice site or the clinic or wherever I'm practicing medicine quarterly. So they have to be there for that. The state of Alabama does require this, but other states are kind of allowing more freedom for the nurse practitioners. So if you kind of go up north, the nurse practitioners may be able to provide care more independently than Alabama. So Caroline, what do you think the scope of practice, or what I'm able to do? What do you think some things might be that I would be able to do?
I think you're able to assess patients, give patients medicines, injections, shots, I guess anything but surgery.
Okay, so that's pretty accurate as well. So in the state of Alabama, we're kind of limited on the amount of care that we're allowed to do, or our scope of practice that we're allowed to do. So we have to really work under the direct supervision of the collaborating physician. So in initial management, we're able to assess and diagnose acute and chronic diseases. We're able to manage these disease processes, complete those comprehensive physical assessments that we're going to need. But then we can also advance in our education and advance in our training and be able to do more advanced procedures, like put in more of like central lines, put in chest tubes, things like that. But it has to be under the direct care of the physician as well. So continuing with the scope of practice thoughts or ideas, as far as prescriptions go, we're able to prescribe these kind of maintenance drugs. So stuff for like your cholesterol or for your blood pressure. So more of the maintenance everyday medicines, maybe something for your acid reflux. Now where we're limited to is on what type of narcotics that we can prescribe. So the collaborating physician has to approve all narcotics that are prescribed. There's certain classes of medications, scheduled narcotics, that are approved through the Alabama Board of Nursing that we're allowed to prescribe. So fentanyl, Vicodin, like Tylenol, codeine, you might have heard of Ativan, Brandon, or Xanax, things like that. That's gonna be more of a physician approval that we have to have them sign off on before we can prescribe. So you may have also heard about a thing called a PA, or a physician assistant. And so that may cause some confusion for you on what a family nurse practitioner is versus what a physician assistant is. So with the FNP versus a PA, it's kind of different in the scope of practice and the way that we're trained and how we go about medical treatment. So with an FNP, we're trained with a holistic approach. We have a real big nursing background. We look at the diversity of the patient population, and we care about the whole patient as a whole. So their nutrition status, their home health, their medication management, if they're able to afford medicines, things like that. So a physician assistant is more trained in a direct specialty area, so maybe like orthopedics, and they're only designated for the orthopedics section, or maybe for cardiology. So they're only really able to work in a specific specialty area. They don't really have any medical training until they go to a physician assistant school. So they can get a degree in English and then apply for a physician assistant program. Now they can go through like a nursing program or maybe a biomedical science degree and then go on to PA school, but some of them can just kind of get whatever degree they work in. One of the main major similarities in this is they still both have to work under that collaborating physician. All right, so Brandon, when I'm talking about a family nurse practitioner, do you think that myself or others within the state of Alabama should be able to practice independently? That meaning, like, I don't need a physician or a doctor to approve anything. I'm allowed to practice medicine, prescribe medications, things like that, independently of anybody. I don't need any kind of supervision. What do you think, Brandon?
Well, that's what you went to school for, right? To learn how to assess those situations and resolve those problems.
Okay, I like that. Yes, so I've been through a lot of training with my bachelor's degree or my undergraduate degree. I went through nursing school for 4 years to become a nurse and be able to help and treat patients under the direct supervision of like the nurse practitioner or the doctor as well. And then I went through an additional 2 years to get my family nurse practitioner to be able to provide medicine and be a provider. So I've gone through an extensive amount of training to become independent and hopefully try to become more independent as a provider. So what about you, Caroline? What do you think?
Yeah, I kind of agree with that. I mean, I think that they should trust y'all as professionals to have professional judgment, to be able to make your own decisions and become independent. So yeah, I agree with that.
Okay, so I like both your answers, and just to kind of give you my reasoning on why I think we should practice independently. If we allow the FNP or the family nurse practitioner to practice independently, this is going to open up a huge new scope of practice for all of us. We're going to be able to be in more of those rural community areas, especially within the state of Alabama. The lack of access to quality health care is a major issue that we face every day. People in these rural communities have to drive multiple hours to find good quality health care. If you're allowing these family nurse practitioners to practice independently of a physician, we can get them in that rural community, rural areas, and really provide good quality care to these patients as well. And also it kind of lengthens, or not lengthens, but there's a real big shortage of providers within this area. So if you're encouraging more nurse practitioners to come through and be able to practice independently, that's going to encourage a lot more of these nurses to go through nurse practitioner or their MSN degree and get their nurse practitioner. So, and then it's also going to encourage these nurse practitioners to stay in that primary care practice. A lot of these nurse practitioners, they come out of school and they go to a specialty area like cardiology or orthopedics or OBGYN. So they go into these specialty areas and they don't stay in this primary care setting. So that really hurts on the lack of access to quality health care. So, well, that's all I have today. Do y'all have any other questions about being a family nurse practitioner?
Can people pick their FNPs the same way they can pick their doctors?
They can. So if you go in and you like a family nurse practitioner and you just say, I want that nurse practitioner to be my guy. So. All right. Thank y'all.
Mhm.